Have you ever noticed discolored fingernails, unexplained itchy skin, or foamy urine? If so, don't ignore it. These seemingly small signs could be silent cries for help from your kidneys. It's scary to know that 90% of people with chronic kidney disease don't know they have it until it's too late. In this video, my nephrologist share with you the top 17 signs that could save your life or the life of a loved one. This isn't just a medical story. These are the survival signals your body is trying to whisper every day. Watch until the end, because one of the most important signs is the one you're most likely to miss. 1. Foamy urine. Have you ever looked down the toilet and noticed the thick, white foam in your urine that takes a long time to dissipate? Don't ignore it. It's not a normal phenomenon caused by strong water or waves. Persistent white foam is the first and easily overlooked sign of glomerular filtration membrane damage. Inside the kidneys are millions of tiny blood filtering units called glomeruli. One of their jobs is to retain essential protein molecules, like albumin, while removing waste products through urine. But when the membrane is damaged, the tiny holes open up, and instead of retaining protein, they leak into the urine. Albumin, when mixed with water, creates a foamy layer, much like soap. If you see this foamy layer repeatedly for several days, especially when you don't eat a lot of protein or don't use your urine in the morning, don't hesitate. This is the first sign of chronic kidney dysfunction, and if left untreated, the consequences can spread quickly, starting with swelling under the skin. 2. Swelling. Have you ever noticed a slight swelling in your legs at the end of the day? Or have your eyes suddenly swelled up and your lower eyelids feel heavy? It's not just salty food or standing for long periods of time. It could be a sign of fluid imbalance in the body, a direct result of the kidneys no longer retaining albumin. Albumin is responsible for holding water in the blood vessels, like a net to prevent water from overflowing. When albumin is lost due to leakage through the kidneys, water in the body begins to escape from the blood vessels, spilling into the interstitial tissue, causing edema. Renal edema is most noticeable in the legs, ankles, and around the eyes. If you press lightly on your shin and see an indentation that lasts for a few seconds, that's pitting edema, an important characteristic. Worse, your body mistakenly thinks you're dehydrated, so it retains more water, making the edema worse. And when the water retention mechanism is disrupted, you'll find yourself starting to pee more at night than usual. 3. Nocturia, nighttime. Urination. Many people think that nocturia is due to getting older or due to drinking too much water. But if you're waking up 2 to 3 times a night to pee, that's not normal, especially if it's accompanied by frequent urination, watery urine, or an uncomfortable feeling after each trip. Healthy kidneys naturally concentrate urine at night, allowing you to sleep uninterrupted. But when kidney function declines, this concentrating ability is lost. As a result, you have to pee earlier, pee more often, and don't get a full night's sleep. Shortened sleep not only makes you feel sluggish and your memory declines, but it also slows down the process of cell repair and regeneration. And while you're tired from lack of sleep, your body sends you another signal, this time from a place you might not normally pay attention to: your fingernails. 4. Two-tone nails. You may have never noticed your nails, but if you notice 2 distinct color patches on your nails, the underside, near the base of the nail, is pale white, while the top is reddish-brown or dark gray. That's not normal. This is called two-tone nails, and it's common in people with chronic kidney disease. Why does this happen? When the kidneys fail, urea and other metabolic waste products build up in the blood and affect the circulation under the nails. Changes in blood pressure, oxygen, and pigment cause the nail area to split color abnormally. Although it doesn't cause pain or deform the nail, it's a noticeable red light signal. It doesn't just affect your nails. Excess substances like phosphate in your blood, can also start to deposit under your skin, creating hard, strange lumps. 5. Calcinosis cutis. Have you ever noticed those hard, cartilage-like lumps under the skin on your elbows, knees, or shoulders? You might think they're hard pimples or fatty tissue, but in fact, they could be calcium phosphate crystals that have formed when your kidneys can't remove phosphate from your blood. A condition called calcinosis cutis, normally phosphate, is an important mineral for bones and cellular energy. But when your kidneys are weak, phosphate isn't removed, combining with calcium in your blood to form solid crystals. These crystals can collect under your skin, causing a lumpy, uncomfortable feeling and sometimes breaking off and leaking a white, toothpaste-like fluid. The bigger warning: if these crystals start to attach to the walls of your blood vessels, the consequences can be much more dangerous. 6. Arterial calcification. Have you ever heard that arteries can also harden like bone? This happens when calcium and phosphate in the blood are no longer controlled, depositing in the walls of blood vessels, causing them to lose their natural flexibility. Normally, arteries have smooth muscle layers that flex and expand to regulate blood flow and blood pressure. But when exposed to high levels of phosphate over time, a consequence of kidney failure, these cells get confused and change, acting like bone cells. As a result, the blood vessels, which are normally soft, become hard, thick, and vulnerable. On X-rays, doctors can even clearly see calcified lines running along the blood vessels, something that is not seen in healthy people. This increases the risk of high blood pressure, heart attack, and stroke. Before these serious complications occur, your body often sends another warning: uncomfortable cramps at night. 7. Muscle cramps. Have you ever been sleeping soundly and woken up by a sudden muscle cramp? A sharp pain in your calf, foot, or thigh, even though you haven't exercised too hard or been dehydrated. It could be the result of an electrolyte imbalance caused by your kidneys failing to maintain the right balance of minerals in your body. Healthy kidneys help regulate calcium, magnesium, potassium, and even blood pH, all of which are essential for smooth muscle function. When these levels are out of whack, for example, if you're low on calcium or magnesium, nerve signals to your muscles are disrupted, causing sudden painful contractions. Cramps often occur at night, causing sleeplessness, fatigue, and a reduced quality of life. And if your kidneys continue to fail, your body will start to make up for lost calcium with a familiar reserve: your bones. And that's why you're prone to osteoporosis without even realizing it. 8. Osteoporosis. Do you feel like you are getting shorter? Your back is starting to bend, or even a slight stumble causes bone pain, a cracked wrist? These signs are not just old age. They can be the result of chronic kidney disease that is weakening your bones. When the blood lacks calcium, because the kidneys do not retain or metabolize vitamin D properly, the body will secrete parathyroid hormone to force the bones to release calcium into the blood. Over time, this process makes the bones porous, brittle, and prone to fracture, even if it is just a strong sitting or a light bump against the bed. Spinal degeneration, hunchback, and gradual loss of height are silent warnings, and not just the bones. Your skin also begins to react, especially when the amount of toxins in the blood increases due to weak kidneys. 9. Itchy skin. Itching all over the body, especially at night, without rashes, without allergies. Scratching until the skin is scratched, but still not relieved. This is a very common symptom in people with impaired kidney function. When the kidneys are weak, urea and many toxins in the blood are not properly eliminated and will be deposited in the skin, stimulating the sensory nerves, causing a dull, persistent itching sensation. In addition, your skin is also prone to dryness due to poor sweat gland function, making the itching worse. The annoying thing is that no matter how much you scratch, apply cream, or take allergy medicine, the itching sensation will not go away because the cause lies deep inside the blood, not on the skin dot. And if you feel not only itching, but also an indescribable restlessness in your legs, like electricity running through your body every time you lie down to rest, it is very possible that you have encountered another disorder syndrome caused by the kidneys. 10. Restless leg syndrome. Do you start to feel uncomfortable in your legs when you lie down in bed? Feeling like pins and needles, electric shocks, forced to move or massage to feel better? If this happens every night, you may be suffering from restless leg syndrome, a neurological disorder, often seen in people with kidney disease. Weak kidneys affect the ability to absorb iron and produce dopamine, a neurotransmitter that helps control movement. When dopamine is deficient, the brain sends incorrect signals to the legs, making it impossible for you to lie still, even when you are very sleepy. This syndrome not only causes chronic insomnia, but also leads to nervous breakdown, depression, and reduced quality of life. And if your sleep is increasingly disrupted, you will soon realize that even familiar foods begin to taste different. 11. Metallic taste in the mouth. Have you ever felt a metallic taste in your mouth? As if you were chewing a coin, even though you have not eaten anything strange. This is not a normal taste disorder. This is a sign that your kidneys are having problems. When the kidney's filtering function is reduced, urea, a waste product in the blood, will overflow into the salivary glands. Here, urea is broken down by bacteria in the mouth into ammonia and many other unpleasant compounds. These substances not only cause a metallic taste, but also make you lose your appetite, and make your breath smell like light. Urine, something that many patients feel embarrassed about. If food is no longer delicious, losing your appetite is inevitable. But this is not just a problem of taste, it is a self-defense reaction of the brain against toxins in the blood. 12. Loss of appetite. Do you not want to eat anything, even if it is your favorite dish? Do you feel nauseous, full, or even vomit at the mere sight of food? This could be an early sign of uremia, a condition of toxic accumulation due to kidney failure. There is a special area in the brain that can detect toxins. This area is not separated by the blood-brain barrier, so it is very sensitive. When urea and waste products exceed the safe threshold, the brain will misunderstand that you are being poisoned and activate a defense response. Loss of appetite, nausea, even vomiting, even without spoiled food or viruses. In the long term, you will start to lose weight rapidly without knowing why. When the body is malnourished, the condition of weakness becomes more severe, and you can clearly see this when the body bruises more easily than before. 13. Easy bruising. Do you just lightly bump into the edge of the table and get a visible bruise? Bleeding gums when brushing your teeth? Or do you suddenly have bruises for no apparent reason? This is not thin skin or bad blood, as many older people often think, but it is very likely a sign that your kidneys are not controlling toxins in the blood. When urea and toxins levels increase, they reduce the ability of platelets to stick together and function, the cells responsible for blood clotting. As a result, you bleed easily, have difficulty stopping bleeding, and form larger bruises than normal. This is one of the little-known but extremely typical signs of severe chronic kidney disease. And if kidney failure persists without timely treatment, toxins will spill out of the body through an unexpected route, through the skin. 14. Uremic frost. Have you ever seen someone's skin covered with a fine white powder like salt dust? It's not chalk, not fluff. It's urea crystallized on the skin surface, a dangerous sign called uremic frost. When the urea concentration in the blood is too high, the body has no choice but to excrete urea through the sweat glands. The patient's sweat becomes concentrated, filled with waste. As it evaporates, the remaining urea crystallizes into a thin white layer on the skin's surface. This is a sign that only appears in the late stages of chronic kidney failure and requires immediate dialysis treatment. And urea doesn't just damage the skin. It can also silently attack one of the body's most important organs, the heart. 15. Pericarditis. If you feel dull chest pain, tightness in the chest when breathing deeply, and an abnormally fast heartbeat, it is very likely that the membrane surrounding the heart, called the pericardium, is inflamed. In chronic kidney disease, urea and toxins not only affect the blood, nerves, skin, etc., but can also stimulate pericarditis, making each heartbeat difficult and painful. The danger is that the symptoms are easily confused with common cardiovascular diseases. But if accompanied by signs such as nocturia, swollen legs, itching, loss of appetite, fatigue, then it is very likely that this is a complication of weak kidneys, not simply heart disease. And speaking of fatigue, this is the most common, most obvious symptom, but the most easily overlooked. 16. Fatigue, anemia. Have you ever felt that just walking a few steps, climbing a few stairs makes your heart pound, short of breath, and dizzy? Feeling exhausted all day long, even though you haven't done much? A deep-seated but little-known cause. Kidney failure causes severe anemia. Healthy kidneys produce the hormone erythropoietin, EPO, a signal that stimulates the bone marrow to produce red blood cells. When the kidneys fail, EPO decreases. Red blood cells decrease, and there is not enough oxygen to nourish the body. The result is that you always feel tired, weak, pale skin, short of breath, dizzy, and are easily mistaken for old age, low blood pressure, or stress. Ironically, the final sign of kidney disease is no sign at all. 17. No symptoms, perhaps. The most dangerous thing about chronic kidney disease is that many people do not know they have the disease until their kidney function has been lost by more than 70 to 80%. Because in the early stages, there are often no obvious symptoms. The patient still eats, sleeps, and lives normally until a blood test, urine test, or blood pressure check accidentally reveals high creatinine, high urea, and stage 3-4 kidney failure. That's why kidney disease is called the silent killer. No symptoms. The silent enemy, and the last sign to mention, is no symptoms at all. We classify chronic kidney disease into 5 stages, with stage 1 being the mildest and stage 5 being the most severe, which is usually when you need to start dialysis. The truth is, many people won't notice any symptoms until they've reached stage 3. And if you do find out earlier, it's usually because it's discovered by chance through a blood test or urine test. That's why prevention is key to protecting your kidneys. Prevention, the key to keeping your kidneys healthy. So, prevention is key. There are many reasons why your kidneys can get into trouble. For example, in another video, I discussed a real-life case where a fairly common snack caused serious kidney damage. But the most common culprits by far are diabetes and high blood pressure. These are 2 conditions that are often preventable and for which we have very effective treatments. Another cause that I see more and more often is the overuse of drugs, like ibuprofen and naproxen, which are easily available over the counter at the pharmacy. I think people often underestimate the risks of chronic use of these drugs, not only for the kidneys, but also for the stomach and heart. So I recommend using them sparingly. And if you are using them regularly, talk to your doctor about getting your kidney function checked. Finally, thank you for watching until the end of the video. Hopefully, the silent signs we have just discovered will help you to look back at your own health and take timely action before it is too late. If you find this content useful, don't forget to subscribe to the channel and turn on the notification bell to continue accompanying me in the upcoming videos, where I will share more easy-to-understand medical knowledge that can save your life or that of your loved ones. See you in the next video. Wishing you good health and peace.